Welcome everyone to our mental health Q&A today. With me today is Professor Marisa Young from McMaster University. Welcome to the chat, Professor.
Thank you very much for having me.
Now, Professor, you are an expert when it comes to sort of work-life transitions, getting back into the workforce, and of course, mental health and all the topics that go with it. So what we've been doing over the past few days is we've been collecting questions for the professor, and we're going to present them to her today. She's never seen them before. It's all off the cuff. And if you haven't had a chance to submit your questions, you can still do so in the live chat in this broadcast, and we'll try to get to as many questions as we can in this 30-minute period that we have with the professor today. So for now, we're going to start with some of the submitted questions that we had, and also some of the questions that we've just sort of seen, in our various Q&As that we've done in the past, and I've aggregated some of those as well. So, Professor, are you ready to go? We'll start with the submitted questions.
I'm ready. I'm very excited.
Okay, wonderful. So let's start with Vasu's question. Vasu asks, come January, many workplaces are calling their remote employees back to in-office hybrid environments. And after a long period of remote work, how do we prepare ourselves for meeting our colleagues and conducting ourselves at work?
Yeah, thank you. This is a great question. And I do think that's something everyone is going to be struggling with, particularly come January. I know that this is the case at the university too, where we are being asked to come back in person to teach, particularly as faculty. And we did a survey actually of faculty members to ask them what their thoughts were of going back. And in fact, over 80% reported that they wanted to work still full-time at home. And I think that this is going to be one of the biggest issues, is really having people commit to going back into the workplace full-time, and what the consequences again might be for that, and how to work with our colleagues that we haven't been around for some time. So I have two views on this. First, there's a very positive experience of being able to have the flexibility of working from home, particularly parents with young children might benefit more from this type of model, because then they can be there for if situations arise in terms of childcare. However, we also know that we are social beings and we function best when surrounded by others, including friends and work colleagues. And so the workplace community really is a support mentally for a lot of us. And we have been able to adapt to that over the past 20 months during the pandemic, and relying much more so on the virtual community and different communities, I guess, virtually with which we engage. Yet that's no replacement for the in-person work community. And so I think my best advice for those who are moving back is to hopefully be able to work within some sort of hybrid model, so that it's not immediately going from working at home to back in the workplace. I know that that's going to be very dependent on where people work. But I also think that it's sort of thinking about and shifting the perspective of how this is going to be positive, and how it's going to be great to, kind of quote unquote, have those conversations by the water cooler, and being able to just get up and move away from sitting in front of a computer on Zoom meetings all day, as we had talked about, again, depending on the types of jobs that people have. And so I think that that's what I would very much emphasize to those who are moving into the workplace, and to work with your employer to find the best strategy based on your personal circumstances and, of course, your family circumstances.
Right, absolutely, for sure. And I think, like you said, it's so personal. Some people might be itching to get back to their desks at work, and some people might be really, really hesitant and really apprehensive. So it definitely depends on what's going to work best for you, and I guess your employer as well.
Absolutely. And then one thing I'll just add to that, thinking about too the benefits of going back into the workplace, a lot of my research is around the work-family interface, and how people sort of put on one hat to go to work and then take it off and put on another when they come home to family. And there has been so much of an overlap and compounding of those two roles over the past 20 months with people working at home. And we found in research I've done before with Dr. Sharon Montessor from Wayne State University that commute time is actually the transition where this best happens, right? And so moving away from the workplace in your home is actually a benefit in that regard too. And so while this will be a hard transition, I think that I would encourage people to think about those benefits and how that'll reduce that work-family stress that they might feel, as well as, like I said, the support that colleagues and that workplace culture will provide.
Right, absolutely. Okay, let's move on to our next question. This one comes from Anonymous. Could you provide some tips on work from home best practices for separating work life from home life when you're sharing that physical space, right? Like, this is my office and then my couch is 3 feet away.
Right. That is a great question. And it is very difficult, right? So I can provide some tips and some insights for sure from our research, but I do think it's difficult when you don't have that physical separation. I think that one of the things that we found, and this is more based on some of the qualitative work that we've done, people, when they're switching between tasks, actually getting up and moving away, right? And so if, for example, that it's time to pick up the kids from school, making sure that you're walking down and picking them up from the bus stop, and then spending some time outside of the home so that you can again transition from that work role to the family role. Other examples, though, I think are really trying not to multitask. So we know that this is something we engage with all the time, but it is very psychologically harmful. This is one of the number one stressors we find when it comes to work-family conflict, but also resulting psychological distress. And we feel we're going to get more done, so it's efficient in terms of a time-based perspective, but in fact can cause a lot of complications and add to that sort of psychological pressure and compounding of those tasks in one's mind. And so that would be my number one advice, is to definitely try not to multitask when you are in that physical space where home and work are right next to each other. Try to, isolate or compartmentalize the tasks.
Right. That's a good point, because if you're working, but then the kids need something, or you have to walk the dog, or you have to do whatever. Well, maybe walking the dog is probably a good break to have in the day. But there are definitely, you're right, there's definitely a lot of overlap, especially when there's absolutely no separation of the space, for sure.
Yeah.
Especially, sorry, go ahead.
Absolutely. Oh, sorry. I mean, I think just to pick up on that, we're talking about very different demographics at times. I think, that when we think of work-family conflict, we definitely do think of parents who are struggling with young kids at home, because that's the, population that we see the highest rates there. But there are also people who, are living on their own, and, they are sitting in their workspace, but exactly as you say, then their relaxing space is right next to them. And, I've seen this on Twitter a couple times, the meme where it's, I have 3 screens. One is my work screen, one is my relaxation screen, and one is my connection screen, right? And so you've just got everything that is reduced to a screen. And I think it's important to be mindful of that and try to separate oneself from it. I also think, just as a side note, that there are different forums for which people can engage with their work colleagues compared to maybe family and friends, and to perhaps switch up the venue. So we are using Zoom for everything, and it might be helpful to try to, use a different venue to psychologically sort of decompartmentalize one's role as a friend compared to one's role as a work colleague.
Right. That makes sense, for sure. Okay, let's move on to the next question here from SPC. As much as I enjoy spending time outdoors, it makes me anxious each time I step out, as people are not following social distancing rules properly. How can I get over this and, get out there?
Yeah, this is a really good point, and particularly not, I think, an isolated comment, that there are a lot of people who are feeling trepidation about going out and being around people again, and trying to identify what is the appropriate social behavior and interaction, because we have been socially isolating for so long. And I think I had the fortunate opportunity to talk a little bit with John Wells from the Hamilton Spectator about this, and particularly around COVID rage. And I'm not saying SPC is feeling this type of rage, but it does relate to, we have lost confidence in our fellow neighbors, and in some cases, those political institutions that are kind of helping or should help to have people mindful and respectful of these different qualifications, particularly around the safety, wearing masks, keeping socially distanced. And so I think what we need to do, and this is a broader goal, we have to reestablish that trust in one another. And so imagine, you lived in a more disorderly or disadvantaged neighborhood where there were constant threats around you every time you did step outside of your door. You develop a mistrust of people around you. And this too is very psychologically distressing. And some of the work that we've done on communities and neighborhoods show this very true. And I think COVID can be seen as that sort of ambient or contextual stressor that has forced us to feel, mistrusting of one another. And so now that some community organizations are reopening, and that it's a little bit more and safer to engage with one another again in neighborhoods and communities, I feel like that is really a first step where we're going to have to push ourselves to rebuild that trust of others around us, to help decrease that trepidation and that worry that we have when we step outside the door.
Right, absolutely. And I think, like you said, this is a very good way of putting it. I've never really thought about it that way. it's about trust, because so much of the world runs on trust. You trust somebody to drive correctly, you trust somebody to walk on the right side of the road, even just basic things like that. And which is why when one steps outside the door, you trust that they're going to keep their distance, so they're going to wear their masks and things like that. So that's a really great way to frame it, is trust in your sort of fellow human beings, for sure.
Absolutely.
Okay, let's move on to Misha's question. Misha asks, with the holiday season coming up, the festivities and family reunions are a stark reminder for some that they've been distanced from their family living abroad for a very long time. Continued uncertainty around COVID in some parts of the world definitely keeps families apart. So how would you navigate this holiday period? Is there any shift in perspective that could help?
Yeah, that's a great question. And I think it is really disappointing. We are going into our sort of full second holiday season with these unfortunate restrictions, and particularly with those who do have family abroad. And so I think, from my perspective as a sociologist, when it comes to mental health, there is a lot of focus on shifting perspectives. And so I really do appreciate Misha sort of putting this into her question of how do we shift that perspective. And I think, one of the things to consider is really the importance of how gathering with others, even if it's not family that you can be around, is very important during the holiday season, right? So not to try to engage with others and not isolate yourself because you can't be with these family members. And so that's where too, it relates to engaging again with individuals' own communities and finding those support systems physically rather than just simply virtually, right? And so that is, one of the number one things that comes to mind when I think of this question and these challenges that families like this will have, because I think there's only so long that you can kind of have that optimism in your mind of I'm going to be able to see them again soon, as long as that doesn't detract from ensuring that you do have plans with others around the holiday season, so that there's not that loneliness or that isolation that unfortunately will then be more detrimental.
For sure. Like, we have a Friendsmas Eve coming up in December. That's something that we're all looking forward to in my life, because like you said, I myself am an immigrant. I live very, very far away from my family in India. And so definitely there is something to be said about sort of that in-person connection, even if it's not with, your blood family, it's the family you choose that
Yes.
you want to hang out with, for sure.
Absolutely.
Okay. And then, this is a similar, connected to family. Let's take Z's question. Z asks, any tips on how to combat loneliness? I live far away from my family, and now that winter is here, I may not even see my friends outdoors that often.
Yeah. Oh gosh. And I definitely do feel we've seen a couple sort of secondary pandemics arise with COVID. One, I think, definitely related to mental health, and under that umbrella related to loneliness. So I have a colleague at University of Calgary, Dr. Alex Burman, who does a lot of work on loneliness. And I think, first of all, it's important to distinguish between those who are alone versus lonely, right? And so to make sure we don't confound that, those who live alone and have been alone during COVID, not always does that manifest into feelings of loneliness. But what can happen when people are isolated and it does manifest into feelings of loneliness is that they further withdraw, right? And so you're already isolated, but then because you've got these overwhelming feelings of loneliness, you're less likely to reach out to your networks to try to get that support. So this is where I would say taking those small steps and re-engaging with the community. Again, a lot of the work that I do is around family-friendly community resources. And so I will pull on that line time and time again, where now that we have different community supports reopening, to think about engaging with them, right? And so, going to your local gym or going to your local library, going to a coffee shop just to be around people, for example, to do some work rather than at home. These small steps, I think, will help to reintegrate people into society generally in this new normal that we find ourselves.
Yes, absolutely. Absolutely. Okay, let's go on to Nick's question. Nick is actually my colleague here at City News. He has a question about Zoom and Skype meetings because it's been our lives for almost 20 months now. So he says, while Zooms and Skypes were good ways in the beginning of the pandemic, some might argue that there's a growing lack of interest in using those mediums as much going forward, especially for those who don't want to be on camera anymore. And so, are there any suggestions to combat the fatigue of communicating communicating and interacting with friends and loved ones just through this sort of, virtual platform?
Yeah, that's a really great question. I think a lot of us are now, in that very mundane mantra of waking up and, you're in front of the the computer screen all day on Zoom or Skype in those meetings. And so I don't doubt there has been a lot of fatigue around that. And I think the fatigue of COVID is a broader topic generally that we really do need to address, particularly kind of, again, moving back into the workplace where it's not like we just can transition from, this space to this space without some rehabilitation, particularly of the mind. And so I think, of course, I don't have specific research on this area, but I do think based on my experiences and that of my colleagues and others that I've heard, is trying to cut down on the Zoom-based meetings, right? And still using the phone, for example, as a phone. You can still have phone conversations. You don't have to be in front of a camera all the time. And I think that that's a really important thing that we forget. Personally, I look at my schedule and oftentimes it's just meetings back to back all day. And I don't recall it being this way when I was in person at the university, right? It was, more people would pop by your office or you'd have a phone call here or there. So I think we can begin to think about transitioning back into that, I guess, what would be considered an older model, just to start to avoid that fatigue. And I think that, employers should also be cognizant of this when they are asking their employees to be present on video in Zoom meetings in the future, right? That we need to kind of all work together, particularly in the workplace, to decrease then those requirements of Zoom.
Right, absolutely, absolutely. Okay, let's go to Ranja's question. This is a really great one as well. With the work from home setup, my home has stopped being my sanctuary where I automatically am able to tune out of work. The lines are very blurred to the point of, being non-existent. So I barely find myself stepping out of my apartment. I've started feeling angry and trapped in this situation, and it's sort of a strain on my mental health. It's putting a strain on my relationships. What can I do to snap out of this funk?
Yeah, this is a really good question. It does relate to, I think, the earlier one that we spoke of too, around the mistrust of those outside of the home. But this is very particular to kind of adapting one's home so that you can break that, the connection between home and family that is driving what does sound like these feelings of anger and somewhat almost resentment towards one's home, right? Which used to be a safe sanctuary. And so this too is where my recommendations would go to trying to engage with those other outlets and community organization resources available, right? And so again, stepping out, going to the library to work for some time if possible, being able to go to a coffee shop, as I mentioned before, right? Just to kind of begin to break that tie and that affiliation that, you end up having to the home that does drive that resentment. And so, it's not the easiest thing to do, obviously, and to break out of that funk will take some time. And hopefully too, again, I'm going to go with employers being sensitive to employees who are going to be still working from home and perhaps in a similar type of situation, but also those who are transitioning out of it, right? And I think when we consider mental health, I do like the analogy of, physical health. And if one broke their leg, it wouldn't be that they're walking, perfectly the next day. There is a process here that we have to think about. And a lot of us have been through, such unfortunate circumstances during COVID that we can't just switch it off. And so I wish I could say this is exactly what you need to do to get out of this funk, but unfortunately it is going to be a process. I am going to also emphasize that level of social support is also important, and to reach out to others. And there are a lot of COVID support groups for people who feel like they're in this exact situation, right? In order to sort of reminisce and have that sort of comparability of circumstances with others, which will then help individuals, I think, move past and normalize their situation, thinking about it as less anomalous, and therefore them all alone feeling that anger or resentment towards their work and home space.
Right, absolutely. And I think one of the things, just even from my personal experience, I think people have sort of started opening up a little bit more about this kind of thing because the pandemic has put it in such stark relief that, mental health is a thing. Mental health is health. And so people are sharing a little bit more. And I think there's a lot to be said about community online, even though, yes, we're trying to sort of meet in person now, but there is a lot to be said about community online and sort of finding that commiseration, which really in some ways helps to feel less alone, to feel like there are other people going through it, and maybe even they have some sort of tips and ways to sort of get out of it.
Absolutely, yeah, and I think that's such a good point. And coming together and having the conversations really is the great first step. And you're right, there is still worry and there is still stigma associated with talking about mental health. But I think what we really want to think about in terms of the mental health circumstances of a lot of people in the COVID context is this doesn't mean that individuals are at a diagnosable level. It's that there is a general sort of state of happiness and well-being that we can think about. And a lot of people are on the verge of sort of, the lesser end of that, where their well-being has been compromised and they can't be the employees that they want to be, the parents they want to be, the sisters, the mothers. It's very much that I think we need to take a more holistic view to, okay, how can we bring our members of society back to a happier state of health and well-being, right? And so, yes, the conversations are important. And I think that very much people reaching out to some of those support groups would be helpful.
Right, absolutely. Okay, let's go to some of sort of the aggregate questions that we've had over the last so many months. How do you stop yourself from doom scrolling through social media and all of the COVID info that is there? It adds to anxiety, but then there's always something happening, always something to stay up to date. So how do you prevent yourself from doing that?
Right. Yeah. So if anyone knows, please tell me too. I know it can be really bad. And it's been so bad too, based on the things that we spoke about, where we're surrounded by screens and this information and almost inundated with all the bad news. And it's very difficult to stay up to date, and particularly people who need to, those that are in your type of profession or in mine as well, we do have to see what's going on, but it is hard to then not get caught up in it. And so I think, a general lesson that I would say from a sociological perspective is understanding how valuable sort of an individual's instrumentalism, or what we'll call a sense of control, is to combating mental health. Yes. And having a sense of control means generally taking, account of the good and bad things. And this very much is an academic term, but we note in survey after survey, this is the number one resource that helps individuals in terms of their mental health. So when I think about these smaller activities, right, where people are doing the doom scrolling, it's to figure out, or hopefully try to strategize with oneself to take back control from when you feel out of control that way, right? And so whether it means that there is a time period where, before bed, the phone is not around, or you're unable to access some of those apps in order to kind of regain some of that control. And I think some of these smaller behaviors will lead to overall beneficial well-being, because it not only is there the secondary component of, yes, all of this negative information that's being flooded your way without any intermittent really good news, as well as that secondary component of feeling sort of that loss of control over one's behavior. And both of those can really lead to higher levels of distress. And I think, it's very problematic, especially if people are doing so right before bed. And we know that one of the additional mental health outcomes of the pandemic has been an increase in sleep problems and insomnia.
Yes.
And these things, of course, are not unrelated. And so I think, it might be a little generic, but yes, putting down the phone and making sure that you take back that control will be very, very helpful in the longer run.
Right, absolutely, absolutely. Okay, let's try and squeeze in a couple more questions. I find that my panic attacks have worsened during the pandemic. I do breathing exercises, but they don't always help. Is there any other way or any other tips to stop a panic attack in its tracks?
This is really interesting. And, not being a therapist myself, I'll be cautious of the advice I provide, but I personally do suffer from panic attacks. So do others in my family. And so one of the number one things that we found are helpful is having some sort of distraction. And so the minute I do start to feel that coming on, I call someone to tell me the most boring story they possibly can, right? And so it's just getting out of the headspace. And so I find that this is helpful in a number of ways, because you do have to transition your mind from thinking about what's happening to your body and not having control over your breathing to something different. And that is oftentimes, again, that social support. If you can have someone that's just on call, particularly if you are finding that they are getting worse, and you know that it's maybe on a weekly basis or something, having someone on call that you can just send the text of, call me now type of thing, right? To help you sort of transition your mindset. And then of course the breathing exercises and feeling as though you've got some safety blanket around you. I know sometimes people with a paper bag, for example, that they carry around with them, that just makes them feel secure. They can look at it when the panic attack starts to come on, and then they can sort of help reduce it. I also think that, we have people in our department where, they've dealt with students, unfortunately, who start to have an attack and they really don't know what to do. And this is particularly in the online context. And so we've developed some protocols around how to deal with that. And I think it's also important that, albeit we don't necessarily want to talk about this condition or situation of panic attacks, it's important that your employer does know, or that others do know, so that you can bring that up in a context where they're aware, and that it might not lead to then kind of a reaction or an attack in front of many others. So those would be my key advice points, again, based on sort of some of the circumstances that I have been aware of myself, as well as with my family and colleagues.
Right. No, that's great advice. Okay, let's shift tack just a little bit. Any tips for couples who are stuck together working from home? For example, how to adjust just being around each other for 24 hours a day, 7 days a week?
Yes, this is a very interesting question, and I do think that I'll kind of draw on the some of the standard points that I have made thus far, that there needs to be some separation, and so having those dinners at home together now, if it manageable financially as well as in terms of schedules, being able to go out for dinner, right? Thinking about ways that you can remove yourself from the home to kind of have that relationship separated from the work. And so it is similar to when we talked about, I think, of like establishing family and work expectations separately as much as possible in the home when it comes to child rearing. The same, I think, could be applicable to couples working from home together. And especially I do have several colleagues where that is the situation, and you do see that it's a constant navigation, and especially if they do have young kids at home. And so I think, again, breaking away from the physical space of the home in order to remind oneself that this relationship is something that is kind of, while in the home, it's something that needs to be worked on outside of the home too.
Right, absolutely. And then this is a good one, because restaurants have recently sort of opened up, no capacity limits, all of that kind of thing. So this is interesting. I feel 18 plus months of pandemic restrictions have affected my social skills, and I'm still very afraid to go out into large groups. So, going out to meet my friends in a restaurant is not possible. How can I reintroduce myself to society now?
Yes, I know. Well, and this is one of those things we're all going to have to work on in some capacity. And I think just, as the brief example of, when we're at a grocery store now and we turn down an aisle and there's someone else there, we automatically sort of avoid them and go down the next aisle, right? And we never would have done that before, right? And so there's these new sort of, I guess I would say, normalized socialization skills that we have been, I think, adopting more so than others. And what I would suggest to this is start slowly, right? Start with just a couple people, start with then a few more, right? And because you're going to have to kind of remind yourself exactly how to interact with people in those social settings, and to not be, I think, worried or mistrustful, again, right? Of thinking back to that idea of developing trust, so that we can get back to at least a new version of what it used to be in terms of engaging with others. Because as I said at the top of this interview, really important to have that social support and to be engaging with others. And so the last thing we want is for people to just continually withdraw because they don't have those or don't feel they have those skills. And I know that there are some supports out there for this exact type of skill development. And so too, maybe we can share those with your viewers after this. I can send you some links based on
Absolutely, yes, we would love to add those to the article for sure. That actually brings us to 1 o'clock. But before we go, I did want to mention on this topic, I think depending on your capabilities, obviously not everybody has the same sort of bandwidth for this kind of stuff, but slow reintroductions, like you said, are a big deal. The first time I went to a friend's home with more than 2 people, if somebody came and sat next to me on the couch, I jumped. It's so foreign now to have somebody come and sit next to you that's not 6 feet apart, that you literally, like, instinctively you feel like running away, you know. Right. So there's and I had to sort of power through it and tell myself, no, this person is double vaxxed. I trust this person. They're a friend in my friend's home. And so there's definitely sort of a reprogramming of your brain almost to tell yourself, like, you're not in danger. This is okay. There's no need to fight or flight, right? There's definitely a lot of that reprogramming.
Absolutely. I think that's 100% true. And it's not surprising, though, that we are reacting that way. We have been under threat for over 20 months. And so this is exactly how we would expect to react when faced with such a potentially detrimental and devastating stressor. And so now we have to learn how to kind of move forward.
Right, absolutely. Well, thank you so much for this really insightful chat, Professor Young. This was really great. Thank you to everybody that submitted your questions. We will have this chat on our website, plus some transcribed questions and the resources that Professor Young said that she will provide for us. So thank you so much for everybody, for joining in, and we will see you next time. Thank you, Professor.
Thank you so much. Thank you.